Let me see, exit full screen. Hi, I'm Beth Shibley, Program Director at Sunflower House here. Until we can reopen our space at Merritt Square Mall, we're working to support caregivers and in the communities by way of video interviewing some folks who would normally be here in person, like Joe Rowlette from Florida Healthcare Plans. Hey, Joe, it's so nice to see you again.
Hey, Beth, good to see you. Thanks for having me.
First, for those people who are watching for the first time and aren't familiar with Sunflower House or with Florida Healthcare Plans, could you just please tell me a little bit about yourself and Florida Healthcare Plans, your organization?
Yeah, so I'm the Group Wellness and Communications Coordinator for Florida Healthcare Plans. I've been with the company for 2 years, and it's a great company to work for. Florida Healthcare Plans, been around for a long time, and I'm just happy to be an employee for the company. The company is actually the second oldest HMO in the country. It started over 45 years ago, and it was primarily stayed just in Volusia County. It was just in Volusia for over 40 years. And about 5 or 6 years ago, Florida Blue teamed up, and they started traveling into other service areas like Brevard County. So now today, we are in 5 counties, Brevard being one of those. And those are the expansion counties that we continue just to keep growing. It's been a great growth for us. We do 3 services. We do Medicare. We do a over 65 Medicare line. We do an under 65, which is we're on the Affordable Care Act marketplace. And then we do group business. We do large groups and small groups for corporations and small businesses.
Okay, thanks for the background, Joe. Now it's becoming more and more evident as we move forward in this new space that COVID-19 is reshaping just everything we do in ways that we couldn't even have begun to comprehend or think about. We're all really having to learn how to do things differently. How has your work in general changed since mid-March?
Yeah, so the biggest change for me personally has been the increase in number of virtual meetings and networking events, and I know I've seen you at some of those as well. So it's where I may have done maybe 4 or 5 a week, maybe even a month. I'm doing 5 or 6 a day now, where I'm doing these computer meetings, and so that's been a big change for me. As far as a company goes, we've really been pushing the virtual doctor visits. So something where we encourage, if you're going to see your primary care, try to do that virtually. Most doctors' offices have that. We have been doing our own for years called Doctors on Demand, and that's something we had in place before the pandemic. And so our Doctors on Demand was something that we kind of had in place, that we kind of thought we were ahead of the game because of that. We also, at our pharmacies, we own 3 pharmacies in Brevard County, and so there's been a shift from doing your monthly prescriptions to do a 90-day, so you don't have to go to the pharmacy once every 3 months, or we do a mail order, so you won't have to go in at all, so you don't have to be around other people in the pharmacy. So the virtual visits, and then the shift in the way you get your pharmaceuticals and your medications has been a big change for us. But we've kind of already had that set up in place. So again, we feel like we're a little bit ahead of the game.
Yeah.
About to happen.
Has the usages of those 2 programs gone up?
They have, and especially we had always looked at a certain percentage of how many of our members do a 90-day or do the mail program, and that's something that we had kind of encouraged before COVID-19. So I do know this percentage. I don't know what they are, but I do know they have gone up quite a bit.
Mm-hmm. Sunflower House exists to support community caregivers. Caregiving for those we love takes a deep well under the best of circumstances, and the current environment is certainly complicating things. Let's flip the lens. Could you speak to how the changes you just mentioned maybe look from a caregiver's perspective? For example, how has accesses to your services changed?
So yeah, I think the caregivers have benefited from the plans that we had already in place. I just discussed. Again, for example, instead of having to drive their loved ones into the pharmacy every month, and a month goes by so quick, you'll say, geez, I just thought I was just here getting your prescription. So it cuts down the amount of drive time. So they can only have to go to the pharmacy, say 3 months or maybe not at all, if they do the mail, if they do the mail order. The doctors on demand, I always feel just from being at the Sunflower House, most of the caregivers and the volunteers are pretty tech savvy. They kind of understand the usages of the computer. So we've seen the caregivers be able to help out with the virtual visits.
Right.
And I think the caregivers would rather do that than have to get in the car, load the car up. You know, it's good to get out, don't get me wrong, but as far as a caregiver, it might be easier to do the virtual visits right in the comfort of your own home without having to leave the home.
Well, sure, and then leave the times that they're out with their loved ones. They can just go to the beach.
Yeah,
exactly. Not just as exciting as going to the beach, Joe. I'm sure.
Yeah. They could go out and do an excursion as opposed to a doctor's visit.
Right.
So having those plans in place, that I think that again it is almost aimed as much at the caregivers as it is just for the patient.
Yeah. So could you speak a little to the portal, your online services? Sure.
So and that's another huge benefit to our caregivers. We have our FHCP.com, Florida Healthcare Plans, but FHCP is our acronym. And our website is fairly interactive. We will be updating it. We're constantly updating it. But our caregivers and our members can go on FHCP.com and get a lot of the questions answered without even contacting one of us. We also have a portal, and each member has their very own username and password, and that even has more information. They can see if a prescription is ready at the pharmacy. They can check on their claims, on their bills. So they can pretty much see their whole footprint right there on the computer.
Right. So that if they've gone to their PCP and they've got they can go in to get an explanation of their benefits or what their copay might have been or whether or not they've still got something going on.
Exactly.
Through their portal.
All those EOBs are right there for them. If they lose a card, they can go on and print their own card. You know, they have access to do a screenshot of what their card looks like until we can mail them a new one. At least they can do a paper copy of their card. So
yeah, I've done that myself. But that really
yeah.
You know,
we have a library. We have a whole wellness library, a whole wellness video library, articles. Just a lot of good resources on those portals.
That's great. That's great. So when all this stuff with COVID-19 began, I think many of us figured that these changes would be kind of like temporary workarounds. We're just going to have to do it for a little bit. And I think we're all coming to the realization that many of these new ways of doing business are here to stay. And like you were saying, some of the stuff you already in Florida Healthcare Plan already had in place prior to. So this is really kind of in addition to. What do you think will be permanently incorporated into your business moving forward? Again, expansions, changes that might be happening to the portal or to the doctors on demand, the pharmacy thing.
Sure. So for me personally, not talking about the company, just with my position, I foresee myself staying on a lot of these webinars and virtual meetings, just because I can do more of them in a day. I can start one at 1 o'clock, finish it by 1:59, and start a whole other one at 2 o'clock. I don't have to drive from location to location. So
right.
I kind of foresee myself doing, maybe not quite as many, trying to get back to the face-to-face meetings, but I do see myself staying with the virtual visits. As far as our business goes, what I've heard is the doctors are very happy. The doctors, these providers and these specialists have really taken a liking to these virtual visits. They can, again, same thing, they can see more patients. The patients can do it from their home. Sometimes these doctors have been doing it from their home as well. Mm-hmm. And so I see more virtual visits from a patient staying at home and the doctor may possibly being at the office.
Right.
So some of the things that people have switched over to do, like Doctors on Demand, if someone is participating in that program, they may just stay with that. They may just stay with Doctors on Demand and maybe not go back to the other way. Same with the pharmacy. If someone switched from a monthly prescription to a 90-day or to a mail order, I don't think they're going to go back to that 30-day. I think they're just going to stay with what they have. And that would be just a change for us to where we were just 3 months ago.
Yeah, I agree. I get my prescriptions as a 90-day, and my husband gets his as a mail order. And I don't think he would ever go back to having to go back and stand in line and wait for the prescription and all of that stuff. You know, there's so much more convenience to being able to do a lot of these things online that once you get over the initial hump of the whole scared thing about being online and having to get onto the internet, it really is super convenient. So I absolutely agree with you. I think a lot of this stuff we're going to see people deciding that they're just as good, you know, they're just as happy doing things online as long as it meets their needs.
And I think that's where the caregivers come in. I think the caregivers are that piece can maybe put the puzzle together and say, hey, let me show you how to do a virtual meeting. Let me help you log onto your computer, or maybe help you with that password or whatnot. So I think that's where the caregiver comes in. So
you're absolutely right. Finally, Joe, what would be one thing you'd like our viewers to take away from this conversation?
So I think the biggest thing that I've learned just from being with this company is that, you know, with over 45 years of experience, the company started off thinking outside the box. You know, it was the only second HMO in the country. And so over the last 45 years, we've been able to, you know, use technology and try new things, kind of do new ways of medicine, to where when this pandemic came about, we were maybe not ready. I don't think anyone was ready for it. But I think the fact that we were involved with technology, we were thinking outside the box already, it kind of made it as seamless as possible. We were able to take our members in and kind of train ourselves. We had to learn as well, but we trained our members, trained our staff, and I think we were able to make it as seamless as we could. And I think that wouldn't have been possible if we weren't already forward thinking so many years ago.
Right. You know, thanks so much for talking with me today, Joe. I'm looking forward to doing more of these virtually online that we can put up on our Aging Matters in Brevard. Thank you to Florida Healthcare Plan for how much support you're giving to Sunflower House now and in the past. You know, for those folks that are familiar with Sunflower House and our movies, Florida Healthcare Plan is our sponsors of our Friday movies when we get back to doing it live and in person. They're the ones that make it possible for us to show these great movies right here. You know, we would struggle without your support, Joe. So thanks so very much.
Well, thanks for having us involved. We love being involved with the Sunflower House. So, you know, I'm happy to get involved in any way. And when this whole thing ends, we'd love to get back in there again.
Yeah, we're looking forward to it. We're chomping at the bit to get back into it. And like I said, we're going to move forward, and Joe and some of the people that he works with are going to be, in the next days and weeks, we're going to be doing longer presentations and some things that we hope our viewers will find informative and educational, and you know, this is a whole new format. So I'm looking forward to it, Joe. We'll talk again soon.
Well, thank you, Beth. Appreciate it.
Thanks a lot. Bye-bye.
Bye.